So we have designed a completely drive-through, self-scheduled program so that when we send out registration links to all of our potential colleagues, whether they're inside a Banner or any other healthcare facility, they get to schedule their specific time in 15-minute windows. They drive up, we validate the registration they've done online, and then we once again assess them for any potential problems like high risk of allergy. They come around a curve and then they get vaccinated, and then they luckily wait in a holding area for either 15 or 30 minutes, depending on their risk of reaction. And then they get to sail on their way with their next visit already scheduled for them for the follow-up booster.
Can you give us a sense of what sorts of challenges may have occurred that you didn't quite foresee?
So in the first few days, we probably underestimated the number of vaccines we could do in a given hour. So we thought, okay, we're going to do one in every 15 minutes. So that was one person. But we realized very quickly that the vaccine process can be efficient. And so we very quickly moved from one person every 15 minutes to 4 people to 15 people every 15 minutes so that we can markedly increase the throughput.
There have been some reports here in the state that there were vaccines sitting on shelves. Has that been the case or your experience?
Not to my knowledge. We really try to use up almost every dose that we have in our possession, literally up to the day before we're expecting the next shipment.
Dr. Lee, what is your message to the public as we enter into the next few weeks here? I mean, already there are various calls to suspend activities or to reduce group gatherings. What would you like to tell members of the public who are watching you tonight?
Thanks for that opportunity. I think all of us can do our part to help mitigate the pandemic. And as we look at all of the different tools in front of us, it starts with social distancing and masking and hand hygiene and limiting our contacts as much as possible, because each of those makes a difference. I think people can recall the days of June as we were on a steep upward curve of cases. By public actions such as mitigating public contacts, reducing capacity in stores and restaurants, taking the time to be masked everywhere you go, we were able to beat back that surge. So I'm confident that we can do that again. We just have to come together as a community and commit to everybody's personal action.
Okay, Dr. Joshua Lee, UMC Banner Physician Executive, thanks so much for your time.
Thank you.